Thank you.
Alright, so we're going to give you some updates about flu in Georgia today. We've got an update on the number of deaths that we're seeing in the state. We'll start with Dr. Patrick O'Neill, who is our Commissioner of Public Health, and State Epidemiologist Sherry. So we're going to give you some updates about flu in Georgia today.
Good afternoon, and I want to thank you for the interest in flu here in Georgia. I think it's terribly important from a public health perspective that the messaging that we need to share with the public get out there on a regular basis and a somewhat competitive basis so that more and more folks become attuned to what we're recommending in terms of how to prevent flu if at all possible and how to deal with it if in fact one comes down. Flu is something that's a face every year. We have seasonal influenza every single year, and flu is serious. We lose up to over 50,000 folks every year in the United States from flu. So it's not the common cold. It is something to be reckoned with. And it's terribly important for the public to understand that the best protection that we have against influenza is the seasonal flu shot. Now, the flu shot is not perfect by any means. The vaccines that actually are part of the flu shot are determined many months before flu actually strikes this area. Now, they're largely based on what's been circulating in other parts of the globe, of which we anticipate will come to Georgia, to the United States at a later point. But flu is a very precarious virus in that it's fickle. It changes its constitution with great frequency. And very often, by the time that flu shows up in our area, the virus has mutated or changed from what it started out being. And that's not uncommon. That happens with great regularity. I often hear folks say, well, I don't think I want to take the flu shot because I've heard there's the effect that it's not well matched against the virus that's circulating out there. And our answer to that is the vaccine that's in that particular flu shot actually is vaccines. It's a series of 4 different areas that are intended to cover many different types of flu. And even if the current one that is so commonly circulating now, H3N2, which is typically a pretty nasty virus, it occurs periodically over time, and it's a pretty nasty actor. It causes a lot of illness and a lot of deaths. Even though that virus may not be well matched right now with the flu shot, there are 3 other elements in there that we have to be concerned about, and other flus that are also occurring here in Georgia right now. So the flu shot, although it may not be ideal for H3N2 in terms of preventing the elements, even when it doesn't prevent it, we have fairly good documentation that it may modify the severity of it, although those that contract the H3N2 flu. So we are still recommending the flu shot very highly throughout the state. And we also know that the other strains that are in this particular vaccine, particularly B strain, is beginning to show up. And this vaccine covers that very nicely. So we want the public to understand that it's not too late to get a flu shot if in fact one hasn't taken it yet. And it's available in various areas across the state, but so many people wanting to get it now, we're recommending that they call ahead to wherever they got to go, to the family doctor or to one of the chain pharmacies or to public health to check first, to call ahead and verify that they do have vaccine available. The other thing that is so important, particularly this year with the strains of flu that we've seen, is that antiviral drugs be used in the early stages of coming down with flu. They're most effective if they can be started within the first 48 hours of the strains of flu that we've seen. So early administration is important. And we've had questions about shortages throughout the state. And there have been some sporadic shortages. One drugstore may run out, but another one down the street may actually have the antivirals. So there's not a statewide shortage, but sporadic shortages that typically can be overcome fairly quickly. So the providers that folks are encouraged to see, if in fact they need to get medication, are aware that the recommendations are to go ahead and start antivirals, particularly if they can start within the first 48 hours, and we encourage folks to go ahead and take those as appropriate. That shortens the course of the disease and probably modifies the severity of the symptoms with some significance. So we definitely recommend that folks, if they have a primary care physician or medical home, and it may be a mid-level practitioner that's part of that, it may not be the physician, that they, if at all possible, contact that person to get their immunization or their antivirals rather than going to the emergency departments. Emergency departments in Georgia right now are extraordinarily busy. In fact, in the Atlanta area, you may have heard that Grady has pulled in a portable unit to extend their emergency department. They borrowed this from the state of North Carolina. It's a great unit. Other hospitals across the state are experiencing the same crowding in their emergency departments. And they're essentially responding to this in different ways, but many of them are creating great areas within their areas for patients that are being so that they can actually treat patients in those areas. So I think there is a statewide awareness that steps need to be taken to accommodate the increased demands and needs for folks all across the state. Our numbers of deaths, as is typical with H3 and 2 years of flu deaths, continues to rise. And right now we have 37 confirmed deaths in the state of Georgia. Now, it takes a bit of time to do the confirmation, so I wouldn't be surprised to see that number grow considerably as confirmations proceed. And that's not at all atypical in H3 and 2 years. So we are expecting those numbers to increase. Once again, pointing to the fact that flu is not a bad cold. It's a serious disease. But it's not a disease that folks should be panicked about. There are steps that everyone can take, first of all, to minimize the chance of contracting the disease. And there are common recommendations that grandmothers and mothers have taught their kids over the years. You know, don't reach up and rub your eyes, your nose, your mouth, mucous membranes, because flu virus can get on there and then you pass it to somebody else. So you don't want to do that. Avoid touching anything on the head. Wash the hands frequently. That's really important. Coughing and sneezing can spread the virus. So cover those coughs and sneezes, like with the elbow, like this. But the important things are those simple things that, again, our grandmothers and mothers try to teach us, but sometimes we forget. The other thing that is critically important is that if one catches the virus, don't spread it to others. Don't go into areas where there are a lot of people, like going to church, or going to school, or coming to work. When you get sick, stay home, stay as isolated as you can, so that others don't fall prey to the disease. Those are common recommendations. They sound so simple, and they really are simple. And they really make a difference if people adhere to them. Influenza has been with us, as you know, for years and years and years. There have been really serious outbreaks that we call pandemics, that we have a lot of data on. This is not a pandemic. This is seasonal flu. But it's an H3N2 year, which means it's going to be a fairly serious year. So these common recommendations are so important that we take. But they do make a difference. People can be protected. And if in fact they come down with the disease, the severity can be mitigated. So I want to turn it over to my colleague, Dr. Sherry Drenzik. Dr. Drenzik is the state epidemiologist and has a world of information and knowledge on the epidemiology of flu and also on the science behind much of these common things that I'm talking about. So I would ask Dr. Drenzik to speak next, and then at the end you can question either one of us if you have questions. Dr. Drenzik.
Thank you, Dr. O'Neill. It's a pleasure to be with you all this afternoon. I'll just give a brief overview of the epidemiology of flu activity in Georgia and a little bit nationally this year, and then I'm happy to take your questions. As Dr. O'Neill mentioned, this season is what we call an Influenza A H3N2 year, meaning that is the influenza strain that is predominantly circulating here in Georgia and around the nation as well. H3N2 years are common. As a matter of fact, last season was also an H3N2 year, but its character was a little bit different. We actually saw a kind of much lower level of flu activity spread out over a much longer period of time. We had flu activity well into March last year, and this year we had very early flu activity and very high peaks of flu activity as well. So every season is a little bit different. And what is unique about this flu season, even nationally, is that every state, all 49 of the states, are experiencing, widespread influenza activity kind of all at the same time. Very often what we see in a flu season is that there are sort of pockets of increasing activity all around the country at different times. Some are early, some are later. Here, this particular flu season, the whole nation got hit at the same time, including us in Georgia. And we're still seeing some increasing flu activity, believe it or not, even so late in January. If we look at our flu activity in January, if you look at the first 3 weeks of January, the proportion of patients that were being seen in doctor's offices and in emergency departments for influenza-like illness increased, again, each week by 6% the first week of January, to 9% the second week of January, to 12% the third week of January. 12% of again, doctor's visits being due to influenza-like illness is really very, very high. I haven't seen levels that high since the pandemic of 2009 and 10. So again, this is a very highly active flu season, and again, it looks like we may be approaching our peak activity, but I still think we do have several weeks of flu activity ahead of us. And in any case, all of our surveillance indicators that we look at to look at the severity of flu infections in a given season, again, are also trending up. So we're seeing increases in hospitalizations due to flu. And for us in Georgia, we only track hospitalizations due to flu in the metro Atlanta area, the 8-county metro area in Atlanta. And we also look at influenza-associated deaths to indicate potential severity of these infections. And as Dr. O'Neill had mentioned earlier, we have so far confirmed a total of 37 influenza-associated deaths here in Georgia. And 25 of those were actually among individuals older than 65 years of age. So again, almost 70%, 67% of them in elderly individuals. And if you look at sort of the age breakdown of our 37 deaths, as a matter of fact, 84% of them were in people over 50. So this year in Georgia, we are seeing, again, that these very severe infections resulting in complications that could lead to death are occurring primarily in individuals that are a bit older. However, again, we have confirmed only one instance of a flu death in an individual younger than 18 years of age, what we term a pediatric flu death. And we just confirmed that this week as well. And that is not unusual. Tragically and unfortunately, we usually do confirm, several, 1 to 2 to 3, again, pediatric influenza deaths each and every year. And again, it underscores and it highlights the importance of flu prevention and flu vaccination, particularly among children, but really among everyone over the age of 6 months. And if you haven't gotten a flu shot yet, absolutely do so. I'm happy to take any detailed questions.
Can you talk a little bit about, do you have any details about the child 18 or under who died? Do we have an age or anything like that, or an area?
We really are not in a position to discuss a lot of those specific issues because of HIPAA requirements. To give you specifics, I think would likely identify a specific probability that that individual could be identified, and we basically have to provide privacy for individuals such as that. So unfortunately, we can't give you any specific information, only to tell you that it was in the age range of under age 18. I can tell you this, that it's above 12 and under 18, so it's not a baby by any means.
When you talk about the H3N2 strain, what is more severe about it, or what kind of addition? You know, I've heard anecdotally from a lot of people who have, you know, who got their flu shot and they still got the flu, saying it's unusually rough to get through it. Can you talk about that?
I'm going to ask Dr. Drenzik to talk a bit about the structure of this virus because it's fascinating. Sherry?
So H3N2, influenza A H3N2 strains have actually been around for 50 years now. They actually emerged during the 1968 pandemic as a novel strain. And this particular virus, even though it's been around for 50 years, has done a remarkable job of changing itself just a little bit each year and has some intrinsic ability to try to evade the human immune system. And some of this is not completely well understood and is still being characterized. So again, whenever we have a kind of predominant circulation of H3N2, we have a tendency to see more severe infections, particularly among individuals that may have a compromised immune system, whether they be very young, very old, or have other immune compromising conditions as well. They just can't do, again, the job that is needed to fight the virus quite as well.
So what kind of symptoms would you be on the lookout for if you do have somebody who is a child or an older person or somebody with a compromised immune system? What kind of stuff should send you to the emergency room?
The symptoms of flu are very similar no matter what the strain is. And again, it includes fever and cough and muscle aches and fatigue. But what I would say is a warning sign that should indeed send someone to seek medical attention is worsening symptoms, a very high fever, and again, particularly among individuals that may be at risk for severe complications of flu. So again, as quickly as possible, seek medical attention. If your symptoms are worsening, get evaluated so that you can indeed receive antiviral treatment within that 48-hour window to try to reduce the severity of that infection and prevent hospitalization and other complications.
What antivirals would you suggest? I mean, there's been obvious discussion about Tamiflu, but also some concerns with that. So is that something you're referring to when you say antivirals?
Yes, Tamiflu is basically a trade name for oseltamivir, and that's one of the drugs that CDC has recommended this year. The other one is zanimivir, and both can be effective. Probably the more common prescription is for one of the oseltamivirs, and it can be a generic or it can be the trade version.
And the key is to take that within the first 48 hours?
Yes, if at all possible. Now, there are circumstances where the doctor will make the decision on hospitalized patients that are having a lot of problems beyond 48 hours to go ahead and start the antiviral after 48 hours. The effectiveness is not nearly as good after 48 hours, but there is still some value to it. The other thing that I want to emphasize, and this gets back to a question that I heard earlier, but also it falls into your question, and that is, even before one has the common symptoms of flu, particularly before one has the fever, up to about 24 hours, it's possible to transmit flu before those symptoms occur. That's problematic, and that's all the reason more that we want the general public to be aware that even if they are not symptomatic, that they take the precautions of not touching eyes, nose, mouth, not handshaking where you can pass something to somebody else like that, covering coughs and sneezes, those simple things that I mentioned before, a lot of hand washing, even if one is not symptomatic, because prior to symptoms, there is the possibility of passing it to others.
I have a question regarding one's immune system. In today's era of hand sanitizers and, of course, disinfectant wipes and things like that, do you believe that in children and adults, for that matter, that maybe immune systems aren't quite as strong as they were 20 years ago, perhaps?
I'll start with that, and Dr. Drenzik can jump in with the science answer. I will tell you that my personal belief is that when we have protected children and adults as effectively as we have tried to do with some of these agents, soaps, hand sanitizers, and what have you, that are bactericidal, that we may indeed have not allowed significant immune reactions to have previously occurred, so that when one does come across an agent like a flu virus, potentially there could be less ability for that person to respond. That varies tremendously, though, from one individual to another. And I don't know that I've seen any definite studies that will give me a good guideline as to how much impact those antibacterials have in terms of reducing the effectiveness of immune systems across the board. The concept is that yes, it may, but the ability to know exactly how much and if it's going to happen and when it's going to happen, I don't have any good data to suggest an answer to that. Dr. Drenzik?
No, I am not familiar with any studies addressing that as well, sorry to say.
Is it possible to know the number of flu cases that you're dealing with right now in Georgia or in Atlanta? And do you have a number for last year?
I'll start, and Dr. Drenzik is better at the epidemiology. My answer is no, we don't know the number. We have best guesses, but our guesses are based on feedback that we have from providers that participate in our surveillance system, and also on what we get through syndromic surveillance throughout the state of Georgia in many instances. But there are probably a lot of cases that we don't get diagnoses on. There may be individuals that actually have flu but without any significant symptoms. They may have a strong immune system and be fighting it off very well and not show up at a provider's office or in the emergency department. So we never know the total number, but we tend to know the numbers that are showing up in emergency departments and that are part of our surveillance network, the so-called ILI system, where we get numbers. But those are all general estimates, and we get that every year. And Dr. Drenzik can tell you a bit more about how we compare, but it's really apples and oranges from one year to another. Sherry?
I'll just highlight a couple of details for your question. And one of the points is that even though individual infections with the influenza virus are not considered to be reportable in Georgia, meaning we don't receive reports of each and every single case of flu, we have a variety of surveillance indicators in place that give us the broad picture of flu activity in Georgia. I mentioned one earlier, and that is, again, the percentage of patients that seek care either in outpatient clinics, doctor's offices, or emergency departments. Again, that's the kind of the percentage of the total number of patients seen in these individuals. We also look at influenza-related hospitalizations in Metro Atlanta. We look at influenza-associated deaths in all ages, all around the state. We look at reports of influenza outbreaks, for example, in congregate settings such as nursing homes or schools. And we also do laboratory surveillance for what types of viruses are circulating in Georgia. And you can think of each of those surveillance indicators as forming one piece of the puzzle. And we put all of those pieces together to look at the overall picture of flu in Georgia.
And what are we seeing in terms of hospitalizations right now?
As far as hospitalizations go, and again, recall that we only look at hospitalizations in the 8-county area of Metro Atlanta. And these hospitalizations are laboratory confirmed with flu. And we are seeing an increase, again, in hospitalizations. We've documented close to 700 hospitalizations due to flu so far this season in Metro Atlanta. And the majority of those hospitalizations have been among individuals older than 65 years.
In 2009, I believe that there were 58 deaths associated with the flu. Will this year approach that number in your mind, or even possibly surpass it?
So again, we so far have confirmed 37,
Great.
and I would venture to say that indeed we will approach that number.
How does Georgia stack up in terms of severity with other states?
Actually, what's been interesting about this particular flu season nationally is that, again, all states are experiencing very high levels of flu activity as well, and a number of flu-associated deaths. So again, 49 states have reported widespread flu activity, again, and increasing flu activity, over the last month as well. So again, we are not unique in Georgia.
Do you think we've peaked, or do you think we're going to still see an escalation?
It's difficult to say with certainty, but I think that we may be, I'm hoping that we're close to peaking, but I still think we do have several weeks of flu activity ahead of us. And even if we've peaked and it starts, and the activity levels start to diminish or go down a bit, it doesn't mean we're not still at risk. And so again, all of those prevention measures are still very important. And even again, getting a flu vaccine, if you haven't gotten one, even if it's late in the season like it is, because very often, historically, even in H3N2 years, we see sort of a resurgence of influenza B infections later in the season. So if one hasn't had a flu vaccine yet this year, it may be prudent to do so, even to prevent against circulating B viruses late in the season.
There's also one other thing that I think is very good news for parents out there, and that is, even though the volume of cases of flu across the board in all age groups has been significant, certainly in pediatric practices and pediatric emergency departments across the state. What I have heard, though, from many pediatricians is that the severity of the flu that they're seeing in the pediatric age group has not been as high as in some past years. So I think, and the fact that so far we've only had the one confirmed case of a pediatric flu death is a good sign. So I know a lot of parents have been almost to the point of panic for fear that one of their kids or some of their kids were going to come down with flu. We certainly want those children to be taken in, evaluated, and treated if they need to be. But I think it's important for parents not to feel panic, but to just realize that so far, at least what we're hearing from pediatricians, is that the severity of flu in the very young is perhaps not as great as it has been in some years. Dr. Drensick, do you have any thoughts about why that might be?
No, actually, I don't. However, I think that, again, it certainly underscores for us that no matter what, again, every flu season is a little different, but it really underscores that individuals, if you haven't gotten your child vaccinated against flu, please do so. And if your child develops symptoms of flu, again, please seek medical attention as appropriate and as soon as possible so that they can be evaluated if antiviral treatment is necessary within those first 48 hours.
With the resignation of CDC Director Brenda Fitzgerald this morning, is there any concern about coordinating flu responses, the efforts with the CDC?
We can't really address the situation with the resignation of Dr. Fitzgerald, but I can tell you that our work with CDC is ongoing without regard to who the director is.
Does the flu virus have any impact on your liver? Strange question, I know. Producer question.
In most situations, no, but there are exceptions to that. There are individuals who already have some type of compromise in their bodily systems where the liver would become inflamed should they catch flu. And then there are also other comorbidities where individuals may already have a liver problem, and catching flu would even aggravate that. So typically, in most folks, no, we don't see liver involvement, but certainly it's not unheard of and it can happen.
I've got another producer question from my station. I'm just going to mark this with my thumb video-wise. But the question is, are flu patients with an already weakened immune system more susceptible to catch other viruses which can lead to death, and how does that happen?
I'll start off and then ask Dr. Drensick to jump in as well. Yes, the answer is that individuals that do have that type of compromise, if they catch flu, there may be concomitant viruses that will jump in and aggravate the situation and conceivably could cause death. In terms of the likelihood of that, I can't address any numbers that would suggest how likely that is to happen, but it can happen. Dr. Drazen?
Yes, I'll just add that very often, for example, when we hear about what we call a flu-associated death, in some situations it may indeed be due to the complications or the secondary infections following the primary infection with the flu virus. So for example, sometimes individuals that have a flu infection that may have existing or pre-existing lung compromise, they may develop a secondary bacterial infection, again, following the primary flu virus infection that may indeed be very severe and in some cases may even be responsible for their deaths.
I would add to that too that I think this is another time for us to make a recommendation for those folks that fall into the elderly age group like myself, and that is because of the possibility of this secondary problem with pneumonia. There are ways of preventing many, many types of pneumonia. Many of you probably have heard of the, quote, pneumonia shots. And I think it's very important for individuals in the age group of the elderly to be sure that they're up to date on their pneumonia shots. It will decrease the likelihood of their having a secondary complication with a pneumococcal pneumonia. And that is not an uncommon cause of death in the elderly who have had flu.
Anything else? I know Dr. Drensick and Dr. O'Neill both have 3 o'clock commitments, so.
Thank you very much for making the time to talk to us.
Thank you.
Thank you. We appreciate your interest.
Thank you. Thank you.